Now coming to the pneumothorax, it can be caused by a blunt or penetrating chest injury, certain medical procedures, or damage from underlying lung disease. Or it may occur for no obvious reason. Causes can be primary, secondary, or traumatic. Moving to the primary spontaneous pneumothorax, it implies normal underlying lungs and is caused by rupture of a pleural bleb, which is a small air blister that can develop on the top of the lungs. Then we have the secondary spontaneous pneumothorax, which occurs in association with lung disease that can be chronic obstructive pulmonary disease, COPD, pneumonia, or cystic fibrosis. Now, rupture of the visceral pleura results in communication between the airway and the pleural space. The traumatic causes can include stab wounds, a car crash, or a medical procedure that involve the insertion of a needle into the chest. Okay, so now we have some factors that can increase the risk of getting pneumothorax. These include smoking, which increases with the length of time and the number of cigarettes smoked, even without emphysema. Then we have genetics, in which certain types of pneumothorax appear to run in families. Thirdly, we have the lung diseases, which have an underlying causes, especially chronic obstructive pulmonary disease, which makes a collapsed lung more likely. Next, we have the mechanical ventilation, in which people who need mechanical ventilation to assess their breathing are at a higher risk of pneumothorax. And then we have the previous pneumothorax, which tells us that anyone who has had one pneumothorax is at increased risk of another. This was all about the etiology and risk factors of the pneumothorax. Let's dive into the pathophysiology of pneumothorax.